signatory to the government of the Federation, Boss Mustafa, has called on state governments across the Federation to take the lead in building partnerships in the fight against HIV and AIDS epidemic so as to accelerate the national response to the disease. He stated this at the presentation of the Stewardship of HIV Response in Nigeria 2007 to 2022 at the National Agency for the Control of AIDS headquarters, Abuja. Boss, while reiterating the federal government's commitment to achieving zero tolerance to HIV and other related diseases, calls for greater impact by all actors to boost sustainability. The National Agency for the Control of AIDS, NACA, was established on February 22, 2007 to enhance case detection of affected persons with quality treatment to avoid the continuous spread of HIV and AIDS in the country. It is 15 years down the line since its inception, bringing to this auspicious event aimed at examining the agency's role in sustaining the fight against HIV and AIDS. However, these experts say the strategies put has brought tremendous achievements, bringing to a total of 1.8 million patients on treatment, thus making the country closer to epidemic control and sustainability.
The government is committed to improving the how to address this constitute a key barrier to accessing HIV services in the country. Distinguished ladies and gentlemen, our achievements in the national HIV response underscore the fact that together we can achieve much more. I must emphasize the importance of partnerships as well as the harmonization of programs for greater impact. It is in this regard that I call on state governments to take their rightful place in this national partnership as we develop a sustainable or sustainability framework for the national response.
The most significant of these achievements for the health sector, specifically the National Treatment and Prevention of Mother-to-Child Transmission Program, is the Nigeria AIDS Indicator and Impact Survey, the evidence to guide policy making, programming decisions, and funding priorities.
Earlier, the Director General, National Agency for the Control of AIDS, Aliyu Gambo, while highlighting the achievements, stresses that Nigeria has made significant progress in achieving the UN AIDS target, hence expressed optimism that the agency will build more on the prevention of mother-to-child transmission of HIV to ensure that no child is born HIV positive in the country.
2 decades of sustained fight against HIV and AIDS, Nigeria is on the verge of achieving unique programmatic indicators for epidemic control due to tremendous growth in our programs over the last 6 years. This year, we expect a tremendous growth in our program for prevention of mother-to-child transmission of HIV as we take key steps towards ensuring no child is born HIV positive in Nigeria. Our innovative strategies in program alignment by all stakeholders, service integration at all community levels, and strong political support at all levels made our national response the most COVID-19 resilient in the world, with the highest yield at the peak of COVID-19 pandemic. As we approach epidemic control, we need to end all forms of inequality, leave no one behind, as well as ensure inclusive implementation of our programs at community levels if we must sustain the gains made in the last 6 years.
Meanwhile, Global Fund Country Portfolio Manager Dr. Jane Thomas pledges continuous collaboration with the government to achieve the UN Declaration of Ending AIDS by 2030, thus advocating for both national and domestic resources to accelerate gain.
Global Fund is investing in Nigeria a total of 1.17 billion US dollars. This is an amount that the Global Fund has ever invested in a single country. Out of this amount, 328 million is allocated to the fight against HIV. Continue to progress toward this achievement. We want to say that the country needs a great mobilization of resources, not only international resources, but domestic resources, with more focus on sustainability and country ownership.
Also speaking, the U.S. Embassy Charge Affairs Kathleen Fitzgibbon harps on the need to collaborate in the fight against the epidemic to meet the targeted population living with HIV and AIDS in the country.
We're all supporting 1.7 million people on treatment in Nigeria. 95% of those people have suppressed their viral loads. Why is that important? The control of the epidemic depends on the infection not being spread between people. So if you suppress your viral load, that means you can no longer transmit the disease to another person. This is why it is so critical that we continue to keep people on treatment. As we enroll new people, we do need to find those different populations where we're seeing a new infection. But if we can keep the 1.7 million on treatment and have the virus suppressed to undetectable levels, that is the basis for winning, our winning strategy.
Since its inception, development partners have been at the forefront in the fight against AIDS, tuberculosis, and malaria. It is against this backdrop that experts are seeking a more resilient approach, particularly as 2030 is a few years away from attaining the UN targets. Vincent Okushi, QTV News, Abuja.